The chief doctor at Moscow's hospital has contracted the virus. He met and shook hands with President Putin last week. Lisa?
Thanks, Simon. Secretary of State Mike Pompeo says a State Department official has died from the virus, the first U.S. fatality among the American diplomatic corps from the pandemic. He did not give any details about the official. America is listening to Fox News.
This report is brought to you by Positive Coaching Alliance.
News Radio 920 and 104.7 FM. Traffic.
Here's stop and go on Route 6 West from Toby Street, with the new road layout shifting to the right between routes 10 and 14. The right lane is closed for road work in North Kingstown on Route 4 in both directions near 10 Rod Road. I'm Jackie Murphy on News Radio 920 and 104.7 FM.
Got issues with youth or high school sports? Positive Coaching Alliance can help. PCA, a national nonprofit, offers more than 1,000 free online resources for youth and high school sports coaches, parents, students, and administrators. Visit PCADevZone.org.
Losing sleep over a stressful job or bad boss? It's time to get to know Express Employment Professionals. Express connects job seekers to the right company and is committed to your success. Best of all, Express never charges a fee to job seekers. That's right, finding a job with them is free, and interviewing is as simple as a phone call. Connect on the Express Jobs app or expresspros.com. More than 500,000 people find work with Express each year.
I'm Bill George with breaking news on News Radio.
I will begin, as I always do, by thanking you for everything you're doing and continually urging you to tune in right here every day, 1 o'clock, to get the best, most accurate information about the COVID virus here in Rhode Island. It's my hope that after the end of these, you take a bit of a breath and a sigh of relief. I can't sugarcoat it, but you should at least have confidence that we're on top of it. We're doing better than a lot of other states, and we have a team working 24/7 to keep you safe. A quick announcement. Tomorrow, this press conference will happen at 2:30 instead of at 1 o'clock. I have a call at 1 o'clock with all of the other governors. So tomorrow, 2:30, and then back to 1 o'clock for every other day. I'm very sad to say today to report another 4 deaths on account of the coronavirus, bringing us to a total of 8 deaths here in Rhode Island. We have 86 new cases, bringing us to a total of 488 cases. And the most important number that I'm looking at, we have jumped to 59 people in the hospital. By any measure, going from 41 to 59 people in the hospital in one night is a significant and serious jump. It's one that we have our eye on. It's not surprising, it's not alarming, but you should know we're in a rapid spread phase of this disease, and this is going to get much harder before it gets easier. So it's what we've been planning for. It's why right now we are readying facilities all around the state for another couple thousand hospital beds. We are securing ventilators and PPE. We are calling up extra doctors and nurses. We're working with the hospitals on their surge plans. I can't stop that. This is going to happen. What I can tell you is that we're going to be ready as we can, and we clearly have community spread, and we're in a rapid spread phase of the virus. So, if you're wondering what you can do, what are you supposed to be doing? You're supposed to be buckling down like you never have before. You're supposed to be listening to the directions that I provide and the Department of Health provides, and you're supposed to be not pushing the limits of these social distancing and mitigation guidelines or orders that we're providing you. You're supposed to be taking what we give you and doing that or more so. I want to be very clear about this. Right now in this country, we do not have enough ventilators to meet our needs. We do not have enough masks and respirators and goggles to meet our needs. In the state of Rhode Island, we do not have enough hospital beds. That's a fact. That's a brutal fact. It's a fact. So what that means is I need to buy us some time. We together need to buy some time. We need to buy a little time to ready the system. More testing, more beds, more ventilators, more doctors. Only one way to buy us time. Every single person out there, staying at home, minimizing your contact with other people, washing your hands for 30 seconds constantly, washing your surfaces. This podium is sanitized before I come out here, after I leave, and several times through the day. So I'm going to keep saying it because mitigation depends on you. And for those of you who are doing it, thank you. A little bit of good news. I want to start by acknowledging that last night President Trump approved a disaster declaration for Rhode Island. You may wonder, why is it good news that we have a national disaster declaration? Because it means that the federal government and FEMA will be reimbursing the state of Rhode Island, cities and towns, and school districts for many of our expenses. They will be reimbursing us for expenses that we started to incur as a result of coronavirus starting on January 20th. So these are expenses for cleaning, personal protective equipment, and other expenses that we're all incurring in order to meet the challenge of the virus. I would like to thank our federal delegation, Senators Reid and Whitehouse, Congressman Langevin and Cicilline, who've worked hand in glove with me for the past few weeks to secure this. I especially want to thank my director at the EMA, Mark Pappas, and General Callahan for your incredible work working with me and my team to make this happen. It's a great thing for Rhode Island. It'll give us the resources that we need to fight the virus and to fight the crisis. I mentioned the other day that the most common question I'm getting right now, I'm getting two questions frequently. One is, how long is this going to last? But even more than that, the question is, how can I help? What can I do? How can I help? On Sunday, I asked you to do one nice thing for somebody. I also asked you to write down the list of 5 people who you're going to be in contact with. I really want you to do it. Write down the 5 people you'll constrain yourself to being near. Today, I have another really important assignment for everybody. I want you to write down at the end of every day where you've been and who you've been in contact with physically, not virtually. So hopefully that's an easy assignment, because the answer will be I've been at home and I've only been in touch with my family. But I want everybody at the end of the day to write down all the places you've been and all the people you've been in contact with. I'm going to do this, and I'm asking you to do this. Because in the event that you get sick, and we hope that you don't, but many people will, it'll help us enormously to do the contact tracing. And when you start to feel symptoms, we're going to have to do the contact tracing of every place you've been and everyone you've been in touch with for several days prior to that. So help us out and keep everyone safe. At the end of every night, write down where you've been and who you've had contact with. Keep